Aloha. Thank you for taking time out of your busy day to take part and learn about Medicare. So our first topic today is, what is Medicare? Well, Medicare was established in 1965 as the federal government's covered medical program for seniors, young folks with certain chronic illnesses, and people who had some disabilities. The covered disabilities are ALS or Lou Gehrig's disease, or if you have end-stage renal disease and require a kidney transplant. Medicare then breaks further down into three major components. Part A covers hospital, inpatient stays, skilled nursing facility, some home health services, and hospice services. Part B covers things like outpatient services. This includes things like doctor visits, outpatient surgical centers, physical therapy centers, and of course, durable medical equipment that you need to take home. Things like wheelchairs, walkers, or even oxygen. The last part, Part D, is for drugs. Medicare covers prescription drug medication through private insurance companies. So Medicare itself does not administer a drug plan. They monitor and they license other private companies to take care of their drugs. So that's basically brief on what is Medicare. And you can just think of Medicare as the government form of health insurance that you have access to after you have worked for a certain amount of period and qualify for Medicare. And the next lesson will be how to qualify and how to know if you're eligible for Medicare. Aloha. In this segment, we're going to cover eligibility for Medicare. How do you know if you qualify for Medicare? How do I become eligible for Medicare? All right. So to know if you're eligible for Medicare, Medicare has very strict but very transparent eligibility requirements. The first is that you have to have been living in the US for at least 5 years as a US citizen or a permanent legal alien. In addition to that, you have to have obtained the age of 65 and have paid in to Medicare taxes. Now, you yourself don't have to have paid in, but either you or your spouse has to have paid into Medicare taxes in order to qualify. In addition to those qualification metrics, there is a separate qualification, and that is if you have a disability or a qualifying chronic illness. A list of the qualifying disabilities and chronic illnesses can be found in the show notes below, and pretty much what those are end-stage renal disease, Lou Gehrig's disease or ALS, and if you are collecting Social Security disability. So if you are deemed disabled by the Social Security guidelines and you've been on that disability program for 2 whole years, you will automatically be qualified for Medicare Part A, and if you decide to purchase it, Medicare Part B. So a lot of people ask, hey man, how do I get coverage when I retire? You know, I'm currently an entrepreneur, or I currently own my own practice. You know, my medical insurance is really expensive and I don't think I can afford this, you know, if I don't have my income from my job. And good news is there is Medicare, and if your income is, you know, not phenomenal on Medicare, as of this recording in 2020, Medicare Part B premium is $144.60 per month if you as an individual make about $85,000 or less per year. And what Medicare does for Part A is, as long as you've worked and paid Medicare taxes for 10 years, Medicare Part A comes premium free. Now, Part D, on the other hand, does require some monthly premium, but you can typically find plans anywhere in the mid-teens, so like $15 a month, and depending on your medication can be as high as a little bit over $100 per month. All right, those are the qualifications for Medicare and how to become eligible. Next, we'll go into how to enroll in Medicare. All right, this video is about how to enroll in Medicare. And before we touch upon that particular topic, I need to show you or explain to you how Medicare enrollments periods work. So if you are turning 65, you have 3 months before your birthday, the month of your birthday, and 3 months after your birthday to enroll in Medicare Parts A and B. Now, to go ahead and give you an example, let's say I'm born in June. If I'm born in June, I will have all the way from March, April, May, 3 months. Then I have the entire month of June and 3 months after that. So June, July, August, and September to enroll in Medicare. And the particular enrollment period is called the initial enrollment period, or IEP. So if you're in that time frame, what you can do to enroll is you can either, one, head down to the local Social Security office. I highly suggest scheduling an appointment beforehand rather than waiting in line. The next thing you can do is you can give them a call and ask if you can enroll over the phone. I have linked the phone number in the show notes below. And also you can go online. Online, I have the link down below, and the online method is actually the preferred method for Medicare. You will have to enroll during their business hours. They do ask you some very, I guess, hard to remember questions like, when did you open up your blank credit card account? Or do you still live at this address? Or have you ever lived at this street address? Those are the types of questions they ask you because they really want to verify that you are indeed the person who is applying for Medicare. And if you have what's called the Social Security.gov account, your own Social Security account, you can go ahead and link that over and open up a MyMedicare account, and that will allow you to do a lot of things like enroll in Medicare, print out a temporary Medicare ID card, and check on claim statuses and your deductibles. All right, so that was how to enroll in Medicare. Now that we covered how to enroll into Medicare, how do you know if you're eligible, and what is Medicare, let's go into that specific person or individual who does not need yet to enroll in Medicare, but they are qualified and they definitely need health care. So if you are 65 years or older and you or your spouse are working at a job that has 20 or more employees, you do not have to enroll in Medicare. And the reason for that is when you're working at a job that has 20 or more covered medical insurance lives, that insurance remains your primary insurance. Primary insurance is the insurance that has to pay first on any medical claims. Now let's flip that over and handle what happens if I have 19 or less employees covered in my employer plan. It would be the exact opposite. So Medicare now would be your primary. So in this circumstance, you would actually need to apply for Medicare Parts A and B in order to fulfill your Medicare enrollment eligibility and avoid having any kind of penalty, or even worse, having medical services that are not covered or that are denied. So what happens then if you are indeed denied for coverage because you're supposed to have Medicare? You could be looking at paying for all of the medical service because the primary would not cover, and your secondary, which would be the group or employer plan, would also not cover due to the primary not covering. Now that's not saying that it will happen, but it could happen, and it's written on the Medicare.gov site, and I'll list that in the show notes below where you can find the particular language. So what I would suggest that you do in this circumstance, if you're working, find out if your plan is indeed 20 or more. You can do that by asking the HR, by calling up the plan itself, and finding out what their guidance is on enrolling in Medicare. All right, I hope that answers your questions on what is Medicare, how do I know if I'm eligible for Medicare, how do I enroll in Medicare, and how do I know if I don't need to yet enroll in Medicare. Now the next group of topics that we go into are going to be if you have already received your red, white, and blue card with both parts A and B effective on them. So stay tuned.